injections without FDA approval? And of course, what are the implications of these acts? We discuss in this episode of The Chiefs. Welcome to this Monday edition of The Chiefs, and let's get straight to the point. With us tonight are several doctors. Actually, we start off with two doctors of medicine. Later, we'll go with a doctor of research. Joining us tonight for the first part are former special advisor to the NTF against COVID-19 and public health advocate Dr. Tony Leachon, and also with us is infectious disease and hi, Dr. Tony, and clinical pharmacological expert Dr. Benjamin Cole. Doctors, good evening, and thank you for joining us. Welcome to the Chiefs.
Hello, good evening. Good evening.
Hi, Ben. Hi, Benji. Hi, Ed.
Yeah.
Well, Doc Benji, yeah, I'll start off with you because I understand that you can only stay with us for the first 15 minutes of the show. So Doc Tony, let's
okay.
grill first Doc Benji. Doc Benji, well, you had an interesting remark just this afternoon on social media with regard to yung pagbabakuna ng members of the Presidential Security Group and from what we also understand, members of the cabinet and possibly even the president himself, even though there is no approved drug yet by the Food and Drug Administration as far as COVID-19 vaccines go. Can you tell us about your post? Sabi po ninyo, and I am reading it right now, sabi po ninyo, it's patently illegal, and sabi pa nga ninyo, it appears to be smuggled. Is this how to really describe it?
Well, in the first place, we have to understand the regulatory science, okay? The Food and Drug Administration serves as the bastion, and it serves as the gatekeeper.
The gatekeeper,
for
yes.
Quality, safety, and efficacy of food, drugs, cosmetics, and medical devices, which means that for anything that is utilized for human consumption, the Food and Drug it serves as actually the gatekeeper for making sure that quality, safety, and efficacy is there. Without the Food and Drug Administration, then what do we do with all of the products for human consumption, right? So if you go against the policy of just bringing any product in and then administering it to people, it's a complicated process. Let's look at the scenario of biologicals, vaccines, for example. This requires, number one, a cold chain process. Which means that when it comes in, dapat may distributor na tama, na marunong ng, kasi part of the process is good distribution practice, part of the process of a good distributor, and the process of a vaccine coming into the picture. It should be stored well, it should be stored in the appropriate conditions, even not only for vaccines, but also for food, drugs, and other things that come into the picture for human use. So with that in mind, we have to make sure also that the mandate of the Food and Drug Administration is followed. It is a regulatory agency that oversees manufacture, distribution, and utilization of health products, and it is there to evaluate and issue an appropriate authorization for all of the health products. So the question,
Benji,
the big question.
If I can ask you about that na po, is it possible for any person in the government to shortcut that procedure? Or for example, can the president overrule any decision or non-decision as of yet by the FDA? Could that be done?
Well, the president has overruled on many things already. So this is not an exception to the rule. But there is a different path which they should have taken, which means that, if you wanted to use a drug like this, a biological, in order to say that, because the reason now is that, well, we need to protect the president and therefore everybody around him should get protected and get immunized in the exigency of the service, in the protection of the president. I have nothing against that. That's a good thought. Okay, we have to remember that in the process of trying to protect the president, there is a way of getting the drugs in without having to do it this way. Because it just like sprung a surprise. Okay, so now everybody's trying to rationalize the fact that there is a vaccine and that it was brought in and it is not registered. Okay, so what stops that from people later on saying, all right, let's just bring in any drug for use by the public. You don't need to register it anyway. So it serves as a bad precedence for that
And in
matter.
this case, parang the end the end target is not justified by the way or the means
Yeah,
with
because
which you did it.
yeah, because you have to think also of the fact that sino ang who imported it? Because it did not look like it was just one. It was just for use for one individual. It was imported. I'm sure it was imported as a whole batch because a lot of people were utilizing it. That's one. Second is that how did it get through the Bureau of Customs? How did it get through cold chain process? Because if you're going to get, like, for example, I don't know how many there are, 1,000 vials of it. You can't just carry that in a baggage and then bring in the 1,000 vials, right? Yeah. So technically, it's not registered. So if it's an unregistered product, and how could you bring in one big batch like that? Then technically, it's smuggled, and it's
Okay.
It's considered counterfeit, right?
Okay.
Because it's
Oh,
not declared.
we understand po. Pero po, and Doc Tony, if you want to jump in, you can jump in po anytime. Si spokesman Harry Roque tried to make these distinctions. Sabi ni spokesman Roque, and I think this is what you reacted to kanina. Ang sabi ni spokesman Roque, hindi raw po bawal sa batas yung magpaturok ng hindi rehistrado. Although ang sinasabi niya, hindi bawal yung magpaturok. Hindi niya sinasabi na kung bawal o hindi, yung tumurok o magdala ng bakuna na ituturok.
Well, kung ano lang, actually I agree with Benji. Yung ginawa nila, ang term dyan, res ipsa loquitur, nanggaling sa bibig mismo ng presidente. And then sinabi niya dun sa FDA director na at that time, nandun siya si Undersecretary Eric Domingo. Ang specific law yan, alam na alam ni former Deputy Director si Benji. And ako, for disclosure, I used to work in a pharmaceutical company. Republic Act yan, 8203, Special Law on Counterfeit Drugs. At kung babasahin natin para maintindihan lang, 2 paragraph lang yan. Ang ibig sabihin ng counterfeit drugs, unregistered imported drug product. At ang prohibited act dyan, manufacture, sale, offering for sale, at saka donation, distribution, trafficking. So, dito yung, kunyari, donation, binigay sa'yo. That is a prohibited act. Sino liable?
Government, di ba? So that also covers government.
Yes, kasi ang premise mo nun, unregistered ka pa eh. Wala ka pa FDA approval. So kung dinonate ka, lalabas kang counterfeit. Sinong liable? One paragraph lang. Possessors aside from importer, seller, distributor, owner, manager ng drugstore, hospital, pharmacy, and outlets and premises. At who induces, causes, or allow commission of these acts. At ang definition ng drug, any chemical compound to prevent disease, and that includes vaccine. So napaka-simple nung sinabi ni Dr. Benji ko. And I agree na yun ay isang violation kasi hindi pa siya rehistrado eh. Kaya namin ginagawa yan kasi ayaw namin na makasakit eh. Ang produkto kasi dinadala mo sa FDA yan. Sa yung body ahensya para yung galing na gamot at saka yung safety. Huwag na lang isipin natin minsan lack of efficacy, napupull out ng produkto kung magkaroon ng adverse event. Yan ang pinaka-problema namin. Kasi pag nagbigay ka ng gamot sa unang pagkakataon, binomonitor namin ang side effect. Isa yan sa nakalimutan na parte na baka makasakit yan. And that will dampen yung government program natin to increase the trust and confidence on vaccination na mababa at this point in time.
So that could possibly be the bigger concern here. The effect, any adverse effect of this new drug being brought in without authorization or testing on vaccination as a whole.
That's the far-reaching implication sa akin kasi lahat kasi ng mga produktong bagong nilalabas, meron niyang way. Ang sinasabi nga, may procedure yan, dapat dinidispense ng doktor yan, tapos nililista ang pangalan mo, nilalagay yung demographics, kung kailan binigay yan. Pagkatapos nito, titingnan mo kung may side effects ka. Tapos, isasubmit mo yan sa FDA muli. May proseso doon eh. So, yan ngayon ang problema sa akin mas mahirap ang posisyon ni Eric Domingo. Kasi mismong ang Pangulo ang nagsabi sa kanya and then alam mo ano ang kailangan gawin niya. Very clear naman ang sinabi niya kanina pero saan siya magsisimula ngayon? Yun ang aking nakikitang problema. If the FDA cannot really function right now dahil may question na ganun, paano na yun? Kasi magiging precedent siya for other people to bring in products considering the president and other cabinet secretaries nagagawa yon. So who would stop somebody from bringing in medications to try?
Yeah.
Ang justification lang na gusto sabihin din ni Benji ay yung compassionate rule. Meron yan eh. Kunyari, kailangan ng mga sundalo o ng presidente na protektahan ang sarili niya dahil pinaka-importante siya. Kung hindi ka rehistrado in your country, the president's doctors can request that and then pwedeng ibigay sa iyo yan. May batas po doon, ang tawag doon, compassionate law. Hindi nakarehistro sa iyo, nakarehistro sa ibang, let's say, Pfizer ang rehistrado in other country. Ang problema, itong Sinopharm, hindi rehistrado din doon sa country of origin eh. Or maaari, pwede pala clinical trial, pero showing sana some efficacy and safety. Yun ang problema natin dito.
Yeah.
Kasi
And there is a process pa rin.
Oh, yes.
There is a process pa rin. Doc Benji, I know you have to go soon, pero I want to squeeze in a few more questions with you if it's okay with you. Pero Doc Benji, where do we go from here? I mean, nangyari na, ginawa na, nagbakuna na. What's the next step dapat dito? Should the FDA go ahead and file charges, or can government just say na? Can government just say na it had to be done? We had to shortcut the procedure. It is going to be a debate. And you already saw what Harry Roque said. Meron na siyang dahilan and all that. But as doctors po, where should we proceed from here? Or should you proceed from here?
Well, let's draw the line, okay? Let's just say that you can't bend the law and you can't bend rules and regulations when it comes to this particular use, no? We have to remember that there is one whole process that needs to get evaluated. And the first things first is you need to divulge kung sino yung nagpasok. Okay? Sino nagpasok, paano pinasok, ilan ang pinasok, at ilang nagbigay, sino nagbigay, paano binigay. If somebody is willing to answer all those questions, then we probably will not be talking about this anymore because somebody has to own up to it. Whoever donated it, whoever provided it, should answer why he or she did what he did and or what she did. Because,
Doc, I suppose the bigger question then is who authorized it and who said let's go with let's vaccinate our troops.
Right.
Because that is a policy decision.
Yeah, that's another thing that you have to take into consideration because it's possible that the president did not know, but all of a sudden, since it's already there on the table and it could be given, I don't know whose bright idea this was, but it was wrong from the get-go, and it is still wrong in the end. The end does not justify the means. I mean, we all want. You see, another problem that arises here is complacency. I'll give you the reason why. For example, if the vaccines that were brought here were not kept in good cold chain, that means the distribution practice was not appropriate. Hindi yan nakalagay sa tamang temperature. What's going to happen eventually is that
quality.
Either the patients get a side effect or there's no effect, which is also a side effect. And so if there is no effect and the vaccine is useless, then it gives you the false belief that you're protected. when in fact, you did not receive anything. And so it puts more danger now, a clear and present danger, on the lives of the president, the families of these who got immunized, because they think that they get protected. You have to remember that even the vaccine, the best of them, does not give you 100% protection. And you can still come down with COVID. What more if you have a vaccine that is not regulated?
Doc Benji, before you go, one more question po. Do you think the FDA should go after these people who made these decisions and operationalize this?
Personally, yeah. But I think it's the call of the Director General on how Dr. Eric Domingo will approach this problem. Definitely, they should, because this is not the right way to do it, and it, like I said, no, it might serve as a bad precedent for other drug distributors, manufacturers, and those that plan to bring any drug into the Philippines. You know, somebody just made a comment, and I will say that comment on the air. Somebody was making a comment on the whole trail that I posted and said that suka nga, hinahabol ng FDA, ang renal liver, hinahabol ng Food and Drug Administration, bakuna pa kaya? So, natawa naman ako talaga din doon. And I said na, oo nga naman, no? I mean, you look at the news and you see the whole police force raiding the fireworks in Bulacan because they're not regulated, they're not registered. Why double standards?
Very, very well put, Dr. Benjamin Ko. Maraming salamat for joining us tonight. We wish we could keep you on, but I know you have other commitments tonight. Pero thank you very much po for joining us tonight, Dr. Benjamin Ko.
Yeah, bye. Tony's there. He'll take care of you.
Yes, sir. We'll stay with Tony.
Yeah.
Thank you.
Thank you, Benji. Ed.
Doc Tony, let me ask you that same question. What do you think should be done at this point? Of course, you have heard the explanations from several officials justifying what happened, and like it or not, that will be the narrative for the next few days. Now, it's in the interest of, I suppose, national security, protecting the president from all dangers and all that, and it was maging of political will to do it despite the rules or
Alam mo,
in spite of the rules. What do you think po?
Ed, tatlong bagay lang yan, Ed, na gusto ko i-summarize. I think whoever did yung communication for that night, siguro na-review naman yun. May mga lawyers sila, may mga doctors din. Naimbitahan din yung FDA director. So, ang
You're talking about Saturday night, no? You're talking about the Saturday night address.
Saturday night, oo. Kasi doon na-broadcast yun eh. So the onus right now will be on the part of USEC Director General Eric Domingo kung merong violations doon. And to me, it's a violation of Republic Act 8203 counterfeit. Ngayon, ang suggestion ko sa kanya, kasi sinabi rin niya in that same meeting, nahirapan nga ako kami, Mr. President, to apprehend ni-raid. So, ang sabi ko dyan, it is the FDA kasi is a quasi-judicial body. Pero ang hina ng police power niyan kasi kukonti ang tao dyan eh. So, my other suggestion in another interview, which na-contact ko na, no? Why not contact Secretary Maynard Guevara and ask Secretary Maynard Guevara for evaluation of the nangyari dito sa vaccination na to. Kung may violation, at kasi hindi ka abogado, doktor ka, you can only interpret that. Pero if you have Secretary Guevara with you, malaking bagay. Bakit? Pangalawa, nasa kanyang NBI for the police power. Yung sa tinatanong ni Benji in terms of saan nanggaling yan, it's all police work and investigational eh, di ba? So the FDA Director General can write a letter to the Secretary of Justice para malaman talaga kung may violation doon. Okay, that's the first one na gusto kong sabihin. Ngayon, kinonsulta daw yung medical doctors ng president tungkol magbabakuna. Hindi daw nagpabakuna ang presidente in one story na nabasa ko. Ngayon, knowing what they know right now, dapat sa hindi kung kailangan ng mga nagpabakuna niyan, yung compassionate law. Kasi 'di ba sinabi ng presidente, yung mga gabinete ko at saka mga military, kailangan nila ng tulong ko. Ayaw natin magkasakit yan. Merong rule sa FDA na if a product is not registered in a country but it is involved in a clinical trial and show positive results, then you can use that in that aspect. Ang problema natin lang, hindi natin na-monitor yung adverse reaction ng mga pasyenteng ito, whether nag-improve ba siya or naprotektahan siya. Ang bigger concern na nakikita ko yung sabotaging the government plan. Kasi ang may plan na dapat may priority list ang government yung healthcare workers,
Frontliners first,
yung
yes.
frontliners first. Ngayon nauna yung cabinet members and then members of the military. Na nangyari na to nung sometime in March last year when the test kits were limited and naman ang nagpa-test kits again, people with influence and all. Naalala mo yan, Ed?
Yes.
Na,
It was controversial.
It was controversial. Ganito rin controversial kasi right now, nagamit din yung bakuna right now dun sa mga tao ding nandun natin sa may influence. Now, ito yung far-reaching implications na nakikita ko. I'm not a lawyer, pero itong Republic Act 8203, alam ko to kasi 30% kasi ng drugs in the Philippines ay counterfeit or black market. Yan ang data sa buong Asia. Kaya alam ko yan kung bakit ganito. Kasi kunyari, bigyan kita example ng counterfeit. Yung gamot na Cytotec na ginagamit yan sa ulcer, pinagbawal yan kasi nakakapag-abortion, abortifacient yan. Pero mabibili mo sa Quiapo yan. Pero bawal, pero nabibili mo. So, ang ibig sabihin, kailangan i-check dyan. Kasi alam mo ba ang bakuna ngayon is the most precious commodity in the world. Now, kung magagamit to for the wrong reason right now, then it will actually dampen the whole spirit and essence of the vaccination program of the government. Yan ang kinakatakot ko eh. At the time na kailangan natin na ang daming anti-vaxxer ngayon, ang daming misinformation, maraming fake news. And here you are, coming out from a big meeting ng IATF, the president telling this, parang hindi alam ng presidente. And I would not blame the president, hindi siya doktor. Kasi at tingin ko in good faith, sinabi niya yun eh. Kasi sabi niya, I don't want to tell a lie. Pero hindi naman niya alam na yung ganong kalabala is a commission of a problem eh. That is the biggest dilemma ngayon ng hinaharap ni Eric Domingo. Kasi it was announced in a public meeting, in a high-profile meeting involving vaccination. So what are you going to do? Ako,
parang nagulat na si Dr. Domingo eh. Parang nagulat si Dr. Domingo eh. Kasi when the president said that, ang sabi kagad ni Dr. Domingo, we've raided 3 establishments already. We've been having a hard time making arrests.
Correct. Kaya ako, kasi I know it's difficult to be in the position of Undersecretary Domingo. Ikaw lang ang gagawin ko. Pero kung hihingi ako ng tulong, I will get legal cover from Secretary Maynard Guevara and also from the NBI para lang dun din. And then, ang presidente, ang tingin ko, in good faith siya, I think compassionate law ang mag-a-apply dito that they need the medications. Ang concern ko lang is the adverse event and the far-reaching implication on the national vaccination plan of the government. Kasi ang na-register kasi sa abroad, yung tinatawag na Pfizer at saka Moderna. And here you are, wala pang EUA, ang Sinopharm, yun ang ginamit. Sana meron siyang submission ng EUA sa FDA natin para makita natin. Kung Pfizer siguro ang ginamit dahil established, let's say, sa England and other 40 countries in the world, pwede siguro tayo hindi matatakot kasi nakapagsabit na ng December 23 ang Pfizer eh. And of course, ang rational reason natin, it's proven all over the world, it's just a matter of time, 21 days, then naibigay lang yon. That is to me justifiable. Ang problema ko, Sinopharm, just like Sinovac, 50% ang efficacy according to the studies yung mga Chinese at at walang peer-reviewed study. And that will be difficult if you're using a drug na unregistered tapos with unknown efficacy and safety, and then magka-problema, hindi mo alam kung anong mangyari. And then mababawasan ngayon ang magpapabakuna. So kung umorder ngayon, yung herd immunity na gusto nating achieve, mawawala siya, Ed, and that's the problem that we are facing.
Actually, Doc, I think a lot of people were surprised with this use of Sinopharm kasi parang it came from left field eh. Nobody was talking about Sinopharm. Government was talking about Sinovac, not Sinopharm, which is a completely different drug and different manufacturer altogether.
Correct. Nagulat ang lahat eh, even Undersecretary Eric Domingo eh. So I really don't know. Nung narinig ko lang yan, may discomfort lang ako considering it came from the President and the FDA director is there. So ibig sabihin, ano kayang gagawin ni Eric? Yun ang inaisip ko. And then suddenly, talaga palang totoo. I really don't know what to do if I were in that position. But I think it will start muna with Eric and seek consultation formally with the Secretary Guevara, and from there they can actually proceed. To me, ang justification will be the compassionate rule na you need it and there's a drug that will be needed. Ang concern ko lang, the vaccine use and not known for its efficacy and safety, unlike let's say Pfizer or Moderna or even Astra, na sana ginamit kasi meron deal ang government dito.
Doc, are you talking about the Philippine Compassionate Medical Cannabis Act? Although that refers to medical cannabis eh. I'm not sure if that's the one you're referring to.
Yung Cannabis Act na compassionate, meron din compassionate law. Hindi lang sa marijuana ginagamit, Ed. When I was starting in practice, meron akong patient na merong brain tumor. That particular drug ay hindi present, but it's present in Switzerland. So I will request the neurologist to write a letter to me as a doctor, and then I will write to the FDA, tapos isi-ship yun. Dahil kasi mahal yung gamot, hindi siya mina-market in the Philippines kasi maliit yung market eh. But since
very niche market.
very niche market. Since sa Switzerland, sagot ng ano yon ng gobyerno at mayaman yung pasyente ko, wala siyang choice. Ayun, through the compassionate use law, pwede siyang pumasok. Yun ang aking nakikitang, if I were in the position of the undersecretary, para mapari naman natin a lot of things na nangyayari sa social media. So ako kanina nakita ko yung thread right now sa social media. It's really burning. And a lot of this right now is on the regulatory and the role of the FDA as the bastion, and of course the vanguard ng safety ng particularly products and drugs, and particularly vaccine, na ito ang pinaka-importanting commodity right now in the whole world.
Doc, we just have to go into a break. I hope you don't mind. Can you stay for one or two more questions? We want to ask you naman about the UK variant. That's what they call it, although we don't know if it really is isolated with the UK. Pero we also want to go into that other variant that's cropped up.
That's
so,
okay.
We're just going to a break, so please stay with us.
Yeah, okay.
welcome back to the chief. Still with us is Dr. Tony Leachon, former National Task Force Advisor against COVID-19, and also joining us is Professor Guido David of OCTA Research Group. Doc Tony, Prof. Guido, thank you for joining us. Yung aming dalawang suki magkasama ngayon.
Hi, Professor. Hi, kumusta?
Yes, Doc. Good. Happy
Professor.
holidays.
Thank you.
Let's
Salamatan lang si Professor Edson for giving me also the copy ng kanilang latest research. Thank you, Professor.
Dr. Tony, let me pursue the question kanina that I wanted to ask. Yung B117, the new variant. I'm sorry. Variant. Sorry, the new variant of COVID-19. So far, mukhang wala pa namang indication that it will cause more severe sicknesses. Some reports that up to 70% more transmissibility, pero hindi pa yung confirmed. And all that. So and so far, mga 10 countries already have found indications that there are infections or infected people in their countries. Now, I was watching your Facebook Live last night, and you made a very strong point about certain government policies. For example, yung whether or not we should tighten the borders, among other things. Kayo po, when Dr. Duque, when Secretary Duque said that we will not institute a comprehensive travel ban until there is local transmission of that variety, what did you think?
I think ako kasi cardiologist ako eh. I'm a worst case scenario thinker. Kung nung few index cases lang last year, nag-warn ako niyan 2 weeks before. Basahin niyo yung inquiry 11 months ago. I told them that they should have bordered, dapat nag-close tayo ng border sa mainland China, but we only ordered at Hubei. And then nakapasok siya sa Cebu and then Dumaguete and all. Kukunti ang cases doon. Right now, we're in the midst of an epidemic, downward trajectory, pero according to the OCTA, 1.15 ang reproduction number mo, mababa ang cases mo, pero dahil nakabakasyon ang mga empleyado, so I think in the next 2 weeks, tataas yan. Kasi hindi align yung number of cases with the reproduction number. Number 2, may threat ka ng UK variant. Hindi siya pwedeng i-menos. You know why? Because September 20 pa siya na-discover in a retrospective analysis. So marami nang in and out. And that's why yung European Union, Japan, Canada, Hong Kong, itong Singapore, ang titindi ng kanilang travel measures kasi. Lalo na dun sa mga area walang bakuna. Aanin mo United Kingdom, bakuna sila. And they heard, and I heard also, that the mRNA vaccines may actually act on limitations. But how about us sa country natin na wala tayong bakuna to start with? At ang dating siguro sa atin July. How can you fight it off? The most effective way is actually border control. Kasi ang sa akin, hindi ka naman malulugi kung i-extend mo let's say ng 2 weeks or 3 weeks and then look at the international global agencies kung anong galaw ng WHO, anong galaw ng CDC, kung bumababa in other countries by their border control measures. Then, saka mo ibaba. Rather than complacent ka, cavalier attitude, tapos inalaw mo yan, nakapasok ang isa, tapos wala naman tayo real technology for genome surveillance, hindi katulad ng ibang countries, merong point of care na madadiagnose kagad nila. Though I think pareho rin ang gagamitin, but this is highly transmissible, 50 to 70%. And we don't know kung humalo to the old strain, paano mo yan mahuhuli. So the best thing na nakikita ko while in the infantile stage for us, sa tingin ko border control. And hindi masama doon. Rather than eventually, mag-total lockdown tayo, mas mahirap. Magkaiba yung border control, magkaiba yung lockdown. Sa akin, sa ngayon, habang maaga pa, mag-border control tayo na extended and look at the international global agencies kung anong sasabihin nila. And then wala tayong bakuna. Yan ang ating handicap eh. The other countries nga nag-iingat na, may bakuna pa. Imagine mo, ang Inglaterra, European Union, meron. Ang Singapore, merong bakuna. Mag-i-start sila December 30. Nag-iingat pa. Sa Singapore, whether may passport kang mahaba or tourist ka, hindi ka makaka-enter kasi ang cost ng second wave sa Singapore is actually the OFW. So if we will allow that dito, hindi tayo nag-worst case scenario thinker, baka magsisi tayo. Ang tagal pa ng bakuna bago lumabas. Sayang lahat ng pinagpagura ng IATF, ng NTF, only to go down the drain dahil hindi tayo nag-control ng ating borders. I think we should learn from the past And if we don't learn from the past, we're doomed actually to repeat it like last year.
Mm-hmm. Actually, Doc, well, my last question po, pero I don't know if you agree with this. I was doing some back reading about this new variant. Apparently, there is no certainty. There is no certainty naman talaga that UK is the epicenter of this new variant. It's just that yung UK daw has the most sophisticated SARS-CoV-2 genomic monitoring in the world, and that is why they're able to make the distinction between variants. So for all we know, it's already in a lot of other countries that we don't know of yet, and it could easily come in to the Philippines.
Kaya nga Ede, kung wala tayong technology doon, sabi nga ni Dr. Anthony Fauci ng I'd like to borrow, I would not be surprised kung meron na dito yan sa Amerika, sabi ni Dr. Anthony Fauci. You know why? Because it was discovered September pa and
September.
wala tayong border. September 20, 2020. Wala tayong border control. May direct flight tayo. Dami nating OFW galing of course England because of the healthcare workers. So we assume na nandito na yan. And then yun lang magiging problema natin in the next 2 weeks. And I hope that the RITM and the National Institute of Health will be able to step up to the plate para malaman natin and distinguish between the two. Kasi maghahalo yan At this point in time, I think we need to be more careful right now. And I think Professor Guido will explain. Ang scenario is like this. You have a reproduction number of more than 1.15. But you have a post-holiday rush. You have the threat of a variant na from UK na wala kang technology to how to diagnose it masyado. And then number 3, wala kang bakuna na meron ng ibang country to ward it off. So therefore, ang pinakamaganda at pinakamatipid na gagawin natin is actually border control, and that is travel ban.
Okay, Dr. Tony Leachon. Doc, we'll let you go na po. Si Prof. Guido naman ang gigil natin.
Okay,
But,
thank you,
Doc,
Professor. Bye-bye.
Thank you very much po. Well, Prof, taking off from that, I know you've already released your study, I think just yesterday, that shows that the R naught in the NCR appears to have gone down. I emphasize appears to because even you, sabi po ninyo, baka it's because of the holiday reporting, kaya medyo bumaba. So are we saying po, first let's talk about the figures. Yung R naught dun sa NCR from 1.12 week ago, nag-register po ng 0.95 or less than 1. So how do we contextualize po this new number na mukhang bumaba?
Yes, Ed, it looks like it's going down. Pero yun nga, we have yung caveat dyan is incomplete pa yung picture natin. And, we just reported the R naught because we estimate it every day. So the yung 0.95 is actually, we're not confident that it's less than 1 kasi there's a margin of error of about 0.1. So it could be still above 1. And to contextualize it, for example, yung yesterday's, yung latest data natin, only 20% of tests, yung 20% in terms of the average number over the past week, 20% lang na-register or na-report yesterday. And
okay.
the other
wait,
2 days
Doc,
before that, yeah.
Doc, sorry, just to be sure, 20% lang ng normal reporting ang pumasok yesterday. So meron pang 80% na hindi pa pumapasok.
Yes, and I want to clarify, I don't mean 20% ng laboratories yung nag-report. I mean, the number that we saw is 20% of its normal value in terms of number of tests conducted. And sa past 2 days naman, from 25 to 26, mga 5 to 50% pa lang na report. So that's a lot of data that's missing. And we can try to fill in the missing gaps, parang i-extrapolate natin, but there's a lot of uncertainty in that. And that's why we can't say for sure na less than 1 yung reproduction number. Sinasabi lang natin, this is what it's showing right now. Pero, yung caveat, once the late reports come in, once nag-reopening test centers, then it's possible that tataas siya ulit and it could be back to maybe close to the yung levels we saw just before Christmas, na medyo on an uptick sila.
Doc, are you saying bale na itong number na ito, itong 0.95 is in all probability an artificially reduced number?
Yes. It's an artificially reduced or deflated number. In the same way, nung nag-stop yung Philippine Red Cross from testing a few months ago, ganun din nangyari. Artificially nag-reducing numbers, we saw that bumaba, pero sabi natin, well, it's because Philippine Red Cross accounts for mga 38% of the tests in NCR. Pero yun nga, para mga 40% lang nawala. Ngayon, yesterday, 80% yung nawala. So that's like double yung impact ng Philippine Red Cross. So, I mean, among them, Philippine Red Cross, and they were not conducting tests or limited lang yung kinakonduct nila na tests. And a lot of the major testing laboratories.
Doc, I'm just making projections. Tell me if I'm doing this right. Pero kasi kung 80% kung 80% ng usual numbers ang hindi pumasok in the last few days, pero nasa 0.95 pa rin yung ating reproduction rate. Hindi ba magiging worrisome yung totoong number?
Well, it could be medyo mahirap i-project yung sa reproduction number, pero we could project it sa total number of yung cases reported. So I think yesterday and today, mga 800 yung na-report. So people are parang masaya. Hey, 800, less than 1,000 na tayo. Pero if we project that, if we assume na 40% lang yon ng actual number, then it would mean na we're still averaging mga 2,000 cases per day sa Philippines. So that's how we could think of it. Pero may variability. It could be 1,500 to 2,000, parang ganun.
Hindi naman automatically na dodoble rin yung transmission rate. That does not count.
Right. Hindi naman siya ganun na directly ibig sabihin magdo-double yung transmission rate, especially since we use an average value. But it's possible that yung transmission rate is still around 1.1 or 1.15, which is where we were last week.
Okay. Well, I just think lang do kasi that we need to emphasize that again and again kasi people might be complacent with the numbers eh. Alam mo mga Pilipino. Uy, bumaba yung numbers natin pero sabi ng Octa Research tataas dapat yan pero bumaba eh. So alam mo na.
Yeah, I mean, it's not na we're afraid to be wrong. I mean, we welcome being wrong na pag bumaba and then we're happy. We're happy na bumaba yung cases over the holidays, hindi tayo nagkaroon na surge. We're expecting a surge, and if it doesn't happen, we welcome it. It doesn't mean we're wrong. It just means now maybe our response was effective. Yung messaging ng government and the media was effective. Pero right now, we can't say that for sure. And right now, it doesn't appear na mag-reopen yung mga test centers anytime soon. Some of them might reopen, might be back in full operations na by after January. So, so it means maybe more than 1 week tayong in the blind. Na we're not sure, or we're seeing low numbers, and we'll be seeing a low reproduction number. Pero pagdating ng January 1, biglang magugulat tayo na, oh no, matas pala. I mean, I'm not saying that's what will happen. I'm just saying that is a possibility.
It's a big possibility.
It's very likely, but it's a big possibility. It's about equal chances na the cases are low. Pero of course, the cases will not be this low. Hindi naman sila mag-average ng 800. It could be 1,500 per day to 2,000. That's our realistic estimate. So we're not sure where it is there. Pero wag tayong magulat na biglang tataas siya by January kasi yung mga late cases, mga late reports, and pag nag-reopen, hahabol sila. Yeah. So magkakaroon pa ng surge on top of the normal. So it
Yeah.
may seem like a big surge. Baka mag-average
Yeah.
tayo ng more than
Oo nga eh.
2,000 cases per day for the first few days. And it may seem like magpapanik na naman tayo because it looks like it's, we're not sure. Ang problema nun, we're not sure if it's the late cases or baka yung new variant na pala na pumasok, which is most likely andito na rin sa Philippines. We haven't tested it yet. I think the Philippine Genome Center and the RITM are testing it, are checking if it's here, pero most likely it's here already.
Which is what I wanted to ask you, Doc. Kasi yun nga what's a possibility or probability that we will also have artificially high numbers come January when the test results catch up from the last week and a half of the holidays. So won't the numbers be artificially high naman this time? And what's the possibility that the government will be triggered by artificially high numbers into some sort of extreme measure?
Well, yeah, I mean, it's a real possibility kasi kunyari, we're missing 1,000 cases per day, tas naipon yan. That could be mga 7,000 cases in 1 week. Pag nalabas yan over the first few days after New Year, it may seem like we're averaging 3 or 4,000 cases per day. Baka magpanic na naman yung mga tao, magpanic yung government. I mean, and that's why we have to be able to distinguish where we are. And I mean, part ng trabaho namin sa OCTA, just like last time, we were able to see na yung artificial spike was because yung delay nga sa Philippine Red Cross, meron din nagkaroon tayo ng spike because of yung typhoon evacuations. And then resolve naman yan. So we just have to be patient. Usually, kung may artificial spike, it will resolve after 1 week. Mawala na rin yun. Or it will go back to the normal numbers. If it doesn't, then it means it's a genuine surge. And we have to do something drastic about it.
Prof, would it be fair to say that we will see the real numbers more or less after the first week of January? Ibig sabihin by the second week of January, things will settle down and the numbers will be more accurate and will be more reflective of what is really happening.
Hello, yes, it's definitely fair to say na by after New Year, hopefully we'll be seeing a more accurate picture of what's happening.
Doc, what about this talk of this new strain coming from the UK? Well, of course, it is not yet confirmed with finality, but there's some talk na 50 to 70% more transmissible siya than the original variant. If this is the case, could this throw your future modeling off kilter?
Well, we don't project long term naman, so we only make 2 weeks to 1 month projections. So usually, we can account for that as a short term. We can add some, extrapolations. Yung 50 to 70%, it's not pa naman well established. That's the preliminary science. We just want to be transparent. Na this is a new variant, so a lot of it is still this is new science, new findings. So we don't know that for sure, 100%. Wala tayong 100% certainty about all these things. But what we do know, yung changes sa variant relate to the spike protein. So ibig sabihin, mas contagious siya most likely. Yes. But how much and paano yung magiging effect nito sa wearing of face mask? We think na face masks and face shields would still be the way to combat it, and social distancing. Kasi yun naman talaga if you're wearing a face mask, although hindi naman siya 100%, it won't filter out the droplets at a 100% effectivity, pero at least may reducing chances. And we just have to be smart about it. I mean, social distancing, not staying close to other people, avoiding crowded places. So it's more or less the same strategy na gagawin natin. We just have to be more more strict about it. Kasi hindi na biro tong new strain na to. I mean, we don't know how infectious it is, but we want to be careful, and we can assume that it might be 50 to 70% to be on the conservative side.
Is that why you said a while ago na maybe it's better to just assume that that variant is already in the Philippines, so people keep these measures in mind?
Well, hindi lang yan. I mean, we should always keep the measures in mind because to reduce the transmissions, and habang wala pa dating vaccine, well, akala ko wala pa. Meron na pala, pero, at least wala pa in scale, to the scale that we want. But I just mentioned na it's most likely here kasi it's already in other countries. And hindi naman tayo ganun ka strict with our borders. And, si Dr. Tony Leachon, in a way, I mean, I admire him for, he speaks his mind. I mean, he's not afraid to say it how it is. And border controls are really important dito. And if we don't have strict border controls, at least, or if we don't have travel bans, at least we should be very strict in implementing yung mga protocols for international travelers. That means yung test results nila, yung quarantine, 14 days should be followed. They should monitor these people, do contact tracing, and from what I hear, I mean, there was the story na may COVID positive na nakapasok sa NAIA, and sasakay sana siya ng plane until nakita nila yung test result niya na may television certificate, nakalagay positive siya, but paano yung nakapasok in the first place? So, I mean, things like that, we can't let that happen kasi isa lang makapasok na may variant na ganyan. I mean, that could trigger a potential outbreak. Of course, we're thinking baka andito na nga, but we can't say that for sure until we have the test.
Okay, Prof. Talk to us naman now about any particular areas of concern that we should be looking at now, given your last look at Metro Manila and the other parts of the country.
Well, sa totoo lang, right now we're focused on NCR, and kasama rin yung result and Bulacan for some reason. Kasama yung result in Bulacan. Pero yun nga, we can't really speak of an area of concern because the picture is not complete, and until we get the complete picture, most areas are looking good right now. if that's the data that we have, based on what we're seeing, everything looks good, even Metro Manila, and hindi naman find it hard to believe. I mean, it's a bit too good to be true. Some of my colleagues in OCTA are very skeptic about the picture.
Parang Christmas numbers, Doc. Parang Christmas numbers, medyo may konting mythical element.
Ayun nga eh. Parang may handog ng Pasko. So hopefully, I mean, it's possible naman that the numbers dip because wala na taong nag-shopping masyado. So it's possible. But we can't say for sure until starting maybe next week.
Do you have any parting shots? Any reminders to people? Given the fact that we still have how many more days to go before people go back to work? Sabagay, January 4 is a Monday. I suppose that's when people really go back to work. So until Monday, January 4, that's 1 more week of people possibly merrymaking.
Yes, I know. And yun nga, medyo matagal pa yung holiday natin na ito. And kala ko nga kayo, holiday kayo until next year. Well, ikaw pala. So, back to work. So yun nga, well, let's just enjoy the holiday. I guess, ako rin, if I could stop thinking about this for one day, I mean, that would be a mental holiday for me. Pero, I can't help it. Every day I have to look at the numbers because, I want to check if we're getting better or not. So, sa mga tao natin, sa mga kababayan, let's stay put muna. Let's, have a quiet holiday. The usual message, it's a time for appreciation and for relaxing. We might have to continue this war against the pandemic early next year. Of course, we have to start preparing for that, and that's why we're doing what we're doing. Tayo, media, kami, sa OCTA, sa government, and that's our role in this. Pero for the masses, siguro for the most of the people, siguro muna tayo, relax, just enjoy the holiday. Maybe avoid social gatherings na rin, and avoid going to public places for if if it can be avoided. And yeah, have a safe and responsible holiday, rest of the holiday.
There you go. Safe and responsible holiday, at least for the last week of the holidays. Pahabol na lang po. Maraming salamat, Professor Guido David of OCTA Research. Prof, thank you po for joining us tonight, and Happy New Year.
Thank you, Ed. Happy New Year.
And that will be all for this Monday edition of The Chiefs. We hope to discuss here. We'll keep the conversation going. I'm Ed Linga of One News. Good night.
Nasabi ko, kung sinong may alam dyan na korupsyon, wag mo ka nang magbigay ng pangalan kung takot.